Hello everyone, my name is Anshul, and today I'll be comparing the top 3 AI medical scribes in complete detail. We'll cover their pricing, features, and anything else you need to know about the tools to make an informed decision. But just before we start with our first contender, Scribe Health AI, let me just first talk about what is an AI medical scribe. So, as you can read here as well, AI medical scribe that listens, transcribes, and codes. So, this summarizes perfectly well what an AI medical scribe is supposed to do for you. So, as a healthcare provider, you must be spending like 15 to 20 minutes on a single patient note. AI helps you reduce that time to about 2 to 3 minutes. So, with an AI medical scribe, you'll be able to create your notes much faster than before. Now, again, the AI medical scribe listens to your patient conversations, then transcribes the conversation into text, and then creates a note while adding the relevant ICD or CPT codes. So that's what an AI medical scribe can do for you. So it is, of course, a very amazing tool for busy healthcare professionals. Now, before we dive into all the features of Scribe Health AI, let's just look at the homepage first. Feel free to pause and look at any particular section of your choice. So let's just consider this. Scribe Health saves healthcare providers 8 plus hours weekly through precise transcription and medical AI and medical coding with our AI medical scribe. So just what we talked about, Scribe Health AI promises a lot of time saving with precise transcription and medical coding. So you can expect good transcription and ICD 10 coding inside your note. Now, to compare all the features, let's move down to the pricing page and see all the features that they're offering. So, at $49 a month with Scribe Health AI, you're getting an integration with your EHR. You are getting summaries of the patient sessions that you're doing, and you're getting a huge library of templates and also the ability to create your own custom templates. So, if your practice uses a very custom template with sections that don't generally fit into the generic or usual formats like SOAP or DAP, then you can create your own custom templates as well. Then there are session analytics and data security, encryption, again for data security, call transcript so you know what was said word to word and you can always look back at your sessions. There are treatment reports and the ability to cancel anytime. So you can cancel this subscription anytime. There is no long term contract. You just pay up every month in a recurring subscription that you can cancel anytime. There is also a Teams plan, which will be valid for you if you have a team of more than 10 people. I think you can talk to them for this pricing. So, yeah, that's about the plans. And there is also a 1 week trial with 20 free sessions that you can avail. Now, that was about Scribe Health AI. Now, let's move on to our second AI medical scribe, which is Freed. Freed is another popular AI medical scribe that almost does the same thing as Scribe Health AI. Again, I'm scrolling down the homepage. You can pause and look at the website. Same process, just like Scribe Health AI. You record a visit, generate a note, review, and then save. Now, as per the pricing, Freed AI, although with similar features, is almost priced at double of Scribe Health AI. Let's just go to the pricing page to look at all the features in detail. So you get unlimited node generation just like Scribe Health AI, a 7-day free trial, again, just like Scribe Health AI, specialty specific templates, again, just like Scribe Health AI, learn my format, smart visit prep, magic edit, instant patient instructions, team template library. Let's check out more features: custom template builder, template sharing with your team, upload visit recordings, full written transcript of visit, iOS and Android app, Zoom app, that is a beta app right now, not fully live for all the users probably, Chrome extension for web based EHRs, custom EHR integrations. Yeah. So HIPAA certified and compliant, SOC 2 compliant, end to end encryption, clinic success team, dedicated account manager, admin license management, organized by BA, centralized billing, group volume discount. So, all in all, most of the features are comparable to Scribe Health AI at double the cost per clinician. But there are a few extra features that I'll mention right now. One is the team template library and the ability to share templates inside your organization. This is something that I can confirm Scribe Health AI is working on currently, but it's not a part of their current setup. So you can expect this feature to roll out within Scribe Health AI soon. But for now, you cannot share templates with your team. If you sign up your team, you will be working as standalone providers and not be able to share patients or notes. But that is something in the development pipeline for the Scribe Health AI team. Now, there's also an iOS and Android app. Android app has already been launched by Scribe Health AI as well. They're also coming up with an iOS app very soon. So again, these turn out to be comparable. Yeah, the Chrome extension and custom EHR integrations are all a part of Scrible's offering as well. The HIPAA compliance and everything else seems like the same. So you can try out both the tools. Both of them offer a 7-day trial, and then you should have a better idea of what works better for you. But let's just move on to our third tool, that is Heidi Health. So Heidi Health again works on the similar principle. You record a patient visit, it transcribes, then you can customize the note as per the template you want, and then you get the output, that is the note itself. So all the three tools have the same process, but Heidi also offers certain new features like Ask Heidi, which is like an AI chatbot inside your note taker, where you can, instead of manually navigating the tool, ask the AI to do certain things like chatting with ChatGPT. There is also more options to type mid visits, type things mid visit, so you can edit the note while it is being made. There's a custom template editor, just like the last two tools we viewed, Freed and Scribe Health AI, Memory, and Teams. Yeah, so there are certain new features with Heidi. We'll compare all of them. Yeah, just to compare, let's move down again to the pricing page. So the first thing you see here is there are annual contracts and monthly pricing as well. If you switch to monthly pricing, the Pro plan, that is their least expensive plan, starts at 99 US dollars. So this is the most expensive tool so far compared to both Scribe Health AI and Freed. Now, if you look at the comparison, you see that unlike Scribe Health AI and Freed, Heidi is currently offering unlimited notes inside the free plan itself. So it is offering you unlimited notes, but there is a limit to their Ask AI feature and their custom templates. So you'll not be able to create many custom templates on the free plan. You'll have to go to the paid plan for sure. And inside the paid plan as well, you will not get any EHR integrations. So that is a big minus with Heidi Health, that they do not provide any EHR integrations unless you go to the enterprise plan. So just any plan below the enterprise plan will not give you EHR integration. So you'll have to copy paste your notes section by section inside your EHR. So that is a negative with Heidi Health. But if you're ready for copy pasting, in the unlimited notes, or in the free option itself, you get the ability to generate notes and documents as many as you want. Collaboration, email notes and documents. So they also allow you to create documents out of your notes like referral letters and more, and share them via an email. Again, there is the Teams feature, centralized billing, custom terms of service, all kinds of security compliances, just like the previous two tools. So the major division between the three tools is: number one, pricing. The least expensive tool is Scribe Health AI. All of it has most of the features, and some of them are upcoming features as well. It has most of the features, and more importantly, it integrates with your EHR at the lowest cost possible. Freed is pricier than Scribe Health AI at $90 per month for each provider, and Heidi is the most expensive one at 99 US dollars without any integration. Freed also, though it offers Chrome extension for web-based EHRs, it does not integrate to a lot of EHRs. Scribe Health AI has a more strong integration library compared to both Freed and Heidi. So if your priority is EHR integration, Scribe Health should be your choice. But if you just want to create notes and you're happy with copy pasting each of your sections inside your EHR, then you can also consider Heidi, that offers free notes in its free plan, free unlimited notes, by the way. So, yeah, that was the basic comparison. Now, let's look at these tools and how they operate one by one. So, let's go to Scribe Health AI first. So, Scribe Health AI is fairly simple to use. You just come to the dashboard, you add a patient name. So I'll add the name trial patient. Once you have, okay, so you add the name trial patient, and then select the pronouns. After that, you can select from whatever templates you want to select. There is a template library here to choose from, and then there is the option to create your own template in this custom template builder. You can add sections pre-made or even create custom sections if you want. So there's a lot of flexibility there. Now, once you've added the patient, all you need to do is either upload a file. So you can upload your audio files that you have already recorded with patients, or you can click on capture session and capture the recordings as they are happening. So you can capture live conversations. It can be two-way conversations. It can be dictations, whatever works for you. And there is also a patient context box if you want to add like lab reports or previous context. Even before the conversation with the patient begins, you can add it here, and it will save that and add it as context on top of the conversation you are having with the patient. And the note turns out by taking into context both the text in this box and the conversation recorded using this button. So this is pretty much how you use the tool. This is how you get your note on Scribe Health AI. This default template new patient visit gives you a note like this. There's the session summary, there's subjective, objective, assessment plan. So a SOAP note is the basic note that you can get out of here. You can also edit your note, print your note, copy it in entirety, or copy it in sections. There's also a button to regenerate, so you can regenerate a note if you want to generate it in a new template, or just want to make sure that all the details are captured. So you can regenerate as much as you want. Now, there's also this Scribe Health AI extension that works on top of Chrome. You can record your patients from here while you have opened up your EHR here. And if it is a web based EHR, you can just click on this particular button, and the entire note will be pasted without wasting any time, without having to copy each and every section one by one. The entire note will be pasted in your EHR using this single button. So the integration is pretty handy when you're too busy to copy paste each section and slammed with patients on a particularly busy day. So that was how you use Scribe Health AI. Now let's come to Freed. Freed again works in a similar fashion. You add the patient name. Again, I'll do trial patient. Once you have added the patient, you can select whether it is a new patient or a returning patient. I'll select new patient. And then you can again click on capture session and it'll start capturing the session. After that, you'll just see a note as you see on Scribe Health AI. Freed also has this extension that you can use. Apart from that, all the features like the template library are the same. You have this library of pre-made templates. You can also click on this template builder. So there are certain sections that you can choose from. Again, it looks like it's a little more rigid than Scribe Health AI's template builder because you get already subjective, objective, assessment, and plan built in. With Scribe Health AI, you don't get these limitations or bifurcations. You can juggle them around as much as you want. So that was about Freed. Yeah, looks fairly similar. Let's just try out a note and see how the note format turns out. I have today with me this trial patient that we are seeing. He has severe acne breakout. We'll be treating his acne with benzoyl peroxide 5% gel and the salicylic acid face wash and recommend any antibiotics if necessary. We'll set up a follow up visit in the next few weeks. For now, the symptoms just include itchiness, redness, and dryness on the face. We'll look at the symptoms, and if there are no improvements, we'll schedule some blood work or blood test as well. So I've given it very basic context. Now it is processing on the left, as you can see, just like Scribe Health AI, and we'll be able to see the note in a few seconds. So the UI looks clean, much like Scribe Health AI. There is not much clutter for you to be confused around. So it's very clean, very minimal. You just add the patient, select the pronouns here, select the template from here, and then start capturing the conversation. So fairly simple and easy to use. Now let's just check out the note. So again, visit summary, subjective, objective, assessment and plan. Yeah, so you get everything that you got inside the Scribe Health AI as well. This is something not available on Scribe Health AI yet. This is an AI feature where you can just instruct the AI to edit the note for you instead of you going manually and editing it. But let's see if there's an edit option to manually edit. I can't see one. So it seems like you cannot. So you can also see the full transcript if you want, just like Scribe AI again. But I think there is no option to edit a note manually. So you can magic edit, but I think you cannot edit it manually, like going in. Oh no, you can. You can. So yeah, you can just click on and start typing, and then the new note will be saved. So you can edit the note as well. So yeah, all the features seem to be working just like Scribe Health AI. So that is how you can use Freed as well. Now let's come to Heidi. Heidi, at the very first glance, looks a little more complex than Freed or Scribe Health AI because there are a lot of buttons, and it might just confuse any first-time user. So let's just try to create a new session by clicking here. Again, add the patient details. So I'll add trial patient. Now let's just see. So okay, so there are a bunch of templates that you can select from. Let's just stick with soap because we tested out the others on soap note as well. So we'll select soap, and I'm not sure. Okay, this is again a setting to customize the level of detail, I think, in terms of how your note looks. And yeah, I think I'll start dictating by clicking on this, and then the note will come out. So let us see how the note turns out. I have today with me this trial patient. He is a 25-year-old male, and he's experiencing severe acne breakout. We'll start his treatment with benzoyl peroxide 5% and salicylic acid face wash, and prescribe any antibiotics if necessary later. For now, the symptoms include itchiness and redness on the face, along with some dryness. We'll schedule some lab tests if required after seeing the progress. Let's set up a follow up visit in the next 2 to 3 weeks. So I click on stop, and now it is analyzing the transcript, and it is generating the note. So, okay, it has generated the note. It did not include anything in the assessment or objective. Maybe our dictation was too short for that, but it has included at least the gist of what was said. So, yeah, there is also a template library. Again, you can choose from. You can also create your own template. You can upload or start with a blank template. So, everything there is inside. So, you can view sessions as well. Again, come back to this one. So, again, everything that was there on Freed and Scribe Health AI is also present here. It's just a little more complex to use. It does give you a few more features, so you can copy from here. Again, you can also dictate. Again, there's also a to-do list that gets generated from here. You can look at the transcript. You can add more context after the note is created as well. You can also resume taking notes. So there's Ask Heidi to ask AI to do any kind of editing or anything that you want to do. So there is a lot going on the Heidi dashboard. It's a little more complex, but then you can do more things as well. You can create documents like these: referral letters, patient explainer letter, smart goals, letter back to referring clinician. So there are a bunch of documents as well, which was not possible in Scribe, and I think Freed as well. Yeah, Freed also does not seem to help you generate any documents. So in terms of that, Heidi does offer a few more features, but then there are no integrations to your EHR on any level. And yeah, the pricing is also higher when you compare it to both Freed and Scribe Health AI. So I hope you liked this detailed comparison, and I hope this will help you make a better decision about your Scribe. So drop any comments if you have any doubts, and I'll get back to you. And happy scribing till then. Thank you.